But anyway, I don't know why they can't catch her. I mean, she wears a bright red outfit, for goodness. Anyway, regardless of the problems that our agency has with the lady in the bright red hat, that's not what we're here for today. Tell me a little bit about why you're here. Okay. So, there actually are some medical things that we can do to help with people who are fainting or very, very uncomfortable around blood and needles and things like that. It may help to kind of understand why it's happening, but it's always worthwhile to get other things checked out anyway, because even young people can have heart problems that can cause fainting and things like that. Just because you have a Valsalva event, a vasovagal event, doesn't mean that you have something else wrong with you, but it's always worthwhile for your doctor to check you out. So today, I'm gonna check you out. Otherwise, you should get checked out by your physician out in meat space, because since we're both undercover, I am not your physician, and everything here I say is not medical advice, right? While we're here undercover in this special setting. But officially, out in meat space, you can get taken care of. Let me go ahead and hand sanitize. Sound good? Do you want some? Yeah, hand sanitizer, I mean. So in the big black doctor bag, which is this, I do need to have some hand sanitizer. This cute little frog. I was given this little frog in medical school. Oh, it smells so good. You want some? Oh my gosh. I hadn't heard about the scented ones having less efficacy. I'd heard that it has more to do... I haven't seen a study on it anyway. I'll be quite honest with you. I've heard it has more to do with alcohol concentration, and friction. Friction's apparently important. But, okay. So first things first, go ahead and follow my fingers. Okay, tell me when you see my fingers wiggling. We're just going to do a quick little neuro, and perfect. I know you already had your test with the nurse outside, but just for my peace of mind, can you tell me what this letter is? Okay. I would kind of like to do... I'm just checking some boxes here on my computer next to you. I would kind of like to do a Snellen test anyway, to tell you the truth. What happened? Oh, I don't know. But I am not sure. Okay. Yeah, absolutely. So, that's a good question. The reason that you tend to have so what happens when you faint because of blood? Basically, when you faint because of blood, you have had the misfortune of you saw something that your body interpreted as a threat, and you had your sympathetic nervous system go into such wild overdrive that your blood pressure sensors freaked out. So your sympathetic nervous system makes your heart go really, really, really fast, and if you have a sudden big blood pressure surge, your sensors are supposed to keep that from happening. Everything's so strong. You have this big, strong sympathetic system surge. So your parasympathetic system, which is your relaxation system, right? That's the system that constricts your pupils so that you have less light, so that you can sleep. It's the system that sends blood to your stomach so that you can digest. It's the chill system. The sympathetic system is the system where you're going to fight. It's your fight your parasympathetic system is summoned by these blood pressure sensors that are like, help me, and the parasympathetic system is like, whoa, and shuts everything down. That's why it's called a vasovagal. Your vagal nerve goes, ah, and you end up getting a big blood pressure drop instead of any kind of rise. It's kind of an imprecise way to describe it. We can describe it also without blood pressure sensors, that like your sympathetic nervous system, as it's starting to spill all of its, overspill, then the parasympathetic system overbalances. I remember learning in medical school that there's actually debate about why it happens, but this is my understanding, and we all call it a vasovagal because basically we do know your vagal nerve, your parasympathetic system, bottoms out your blood pressure, blood drains out of your face, out of your head, and you pass out, right? So you get, your body's like, calm down, and forces you to calm down violently, which is, it doesn't always work. So, what does this mean for you? Well, let me have you look at the eye chart, and then I'll explain more, okay? So, let me have you read the lowest that you can read, okay? I think, let's see if you can read like, how about line 7 for me? Okay. And then can you cover up the other eye? All right. How about line 9? That's awesome. And then cover up the other eye. That's great. That's really great. Well done. So, next step, I'm going to just look in your eyes real quick, okay? We're just doing this as part of the neuro. It's unlikely that there will be anything related to your eyes, at least that I can think of. But some people do have tiny seizures that can present as what looks like a vasovagal. So like I said, it's always good to check things out. It's never a bad idea. I'm going to put my hand on your shoulder. I'm going to look in your eye, okay? What I'm looking for here is I am taking a look at your optic nerve. I'm making sure there's no little tiny, blood spots, little tiny hemorrhage marks from your vessels. I'm trying to trace 4 vessels. Looking for your macula, your fovea. Also looking to make sure there's no cotton wool spots. Basically no hypertension, diabetes type stuff. So why don't people suddenly lower their blood pressure when they have hypertension? Good question. So over time, as your body gradually gets used to these higher and higher pressures, the sensors get used to them, especially because they get stretched out. Those blood vessel walls become thick and caked with stuff. Your body doesn't recognize, and the sensors are broken basically. Because they happen over time. I would say a vasovagal is more about the nerves and their interactions between the two systems, the sympathetic and parasympathetic, than it is so much about the blood pressure, but that's just a part of it. The whole system kind of bottoms out. Go ahead and say ah. Okay, I'm going to get the little thing and look in your ear. Here's my little, here we go. Don't want to drop that. Here we go. Alright. So, now ears can cause balance issues and dizziness. Do you feel like the room is spinning at all? Okay. Your ear canal looks clear. I don't see any bulging of the tympanic membrane. I don't see any erythema, no edema. Yep. You do have some cerumen buildup and a little bit of like itchy looking flakiness. Looks like you might have allergies here too, and Same on both sides. Okay, can you smile for me? Puff out your cheeks. Wrinkle your forehead. Excellent. Okay, very, very good. Close your eyes for a second. I want you to tell me when you can hear this sound, okay? Oh, you have great hearing. Oh, excellent. I am going to get a blood pressure on you really quick. I have my janky stethoscope here. This isn't my preferred stethoscope. I have my preferred stethoscope in my emergency bag now, so that I don't accidentally forget it when I travel. Because last time I flew, I was called, and, you know. Alright, blood pressure cuff. I'm going to go ahead here on your right arm. We are going to put this is called the bladder. Put it right over your brachial artery. And we're going to here, and this is so old. I've had this one since medical school, so there's like a big blotch obscuring the middle, but the numbers are still visible, which is the most important thing. Alright. Great. Okay. You moved. Yeah, let's do it again. I mean, you moved. That's what I mean. That's why I let it out so fast. You were moving and talking, and your legs were crossed, and I didn't have your arm at the level of your heart. There we go. Now that'll be an accurate reading. Excellent. Did you know that? When you get your blood pressure taken, your arm is supposed to be at the level of your heart. Your legs should not be crossed, and you shouldn't be talking. Otherwise, you'll get incorrect values. So, you know, some nurses don't bother. I'm not a nurse, I'm a doctor. So I'm not out here trying to criticize nurses. But I'm always very pleased and impressed when someone does it properly, because a lot don't. Alright, let me just put this on your finger. This little pulse oximeter. Okay. It's very loud and it's running out of battery. Okay. That looks good. Oxygen sat looks lovely. Thank you. Whoopie doo. Yes. So, yes, in all probability, you just had vasovagal. It's still okay that you came and got it checked out. Let me listen to your heart, okay? Okay. Over here. And here. And over here. And here. Okay. Yeah, can we go over to the other side of the room and have you stand? Because I want to listen while you're standing also. Okay? Let me have you stand. Okay. Here we go. And here. And here. And here. And here. Excellent. Okay. Can I have you crouch down? Yep. Perfect, right here. we're gonna go into the other room, and I'm gonna have you lie down, okay? Because then I can listen while you're lying down. Okay, here. I'll just lean over you a little here. And here. Here. And here. Great. Excellent. Okay, my dear. It's a very precarious place to put that. Let's continue with some of the neuro stuff. Okay. We did cranial nerves 3, 4, 5, 6, 7, 8. Can I have you? We already did 9 and 10 actually when you opened your mouth and said can I have you? We need to check your accessory nerve, which is number 11. I'm going to put my hands on your shoulders. Can you shrug them for me? Great. Okay, and then stick your tongue out and move from side to side. Excellent. All right, do this. This is checking the function of your cerebellum. Other hand. And this. Can you flap your feet for me? Okay. Can you take your ankle, put it on your knee, and run it down? Same thing, other side, like that. Great. All right. I'm just going to get your triceps reflex, the reflex on your knee, your brachial reflex, right? Mm-hmm. Yep. It's really actually your bicep, the one on your bicep tendon. And then the brachial one too. They're lovely. Sorry, you can't see what I'm doing. There's one here and one here that is important to get. One here and then one over here because there's a muscle body. That'll twitch your hand, twitch your arm. Okay, give me your arm. Good. It doesn't have to be a big response. Okay, over here. Just hold your. I'm gonna hold your arm. Okay. Drop your arm. Let it go. Let me hold the weight of your arm. Okay. Good. And then over here. Good. Okay. And then your knee. All right. Let me have you not look for a second. There we go. Because sometimes if you anticipate it, you cheat. Okay. And then on your ankle. Really, not your ankle, but your Achilles tendon. Good. Nice. All right. I'm happy with those. Okay. So, because the cerebellum, we should do a Romberg. So, let me actually have you go back in the other room and stand up. I almost forgot. There isn't a lot of room in here, so. Okay. I'm gonna have you stick your arms out in front of you like this. Kind of like a Frankenstein, except the hands are up. Okay? And I'm gonna have you march in place with your eyes closed. Okay? But first, just stand with your eyes closed, okay? Just like that. And I'm gonna gently tap you. And here. Okay, good. Okay. Now I'm gonna have you march in place for 30 seconds. I know that seems silly, but that's to check if there's something up with your middle ear or your cerebellum. Alright, go ahead. Alright. And 30 seconds later, here we are. That looked good to me. I'm going to have you go back into the other room because it's more comfortable, and you can lie down while we talk, and I'll teach you some techniques. Yeah. So, there are a couple physiological things that could be helpful for you to know about that whole issue, right? Actually, you do look a little stressed. Can I check the tension in your scalp? This is just a side thing, not related to this, just related to the fact that I can sometimes this up. Back when I was in the military, I studied with some DOs and studied osteopathy, some of their osteopathy, and I learned a couple techniques. Some of what I learned was helpful for scalp tension, which you do have a lot of. So I'll do this while I talk, okay? You just relax here. So, a couple physiological things that are helpful to know. One, if we can tone our sympathetic system. Now, of course, it's an involuntary response. It's not your fault, right, if you pass out. However, we can learn to train involuntary responses over time. I'm not saying that you're going to have, full control of your heartbeat or your vagal nerve or anything, but I'm saying just like, so when a baby is little, it doesn't have a developed proprioceptive system, which is why it falls down and has trouble walking. As it's developing its proprioception, it improves its proprioception as it learns to walk, basically. Basically, your nervous system is malleable, is what I'm saying. We have one of the most hackable computers in our bodies of anybody. This sounded giving me tingles, actually. Not a super professional thing to say, but just ASMR stuff. So, a couple ways that we can kind of tone your sympathetic and parasympathetic system is by regular breathing training. This is what they do, like Tibetan monks and stuff like that do. And actually, I can give you a handout that was given to me by the VA by this really neat doctor, and I can give you a link to one of his videos too, actually. And it's basically a system you'll go through for a couple weeks, essentially training yourself some breathing techniques. Well, something almost fell on your head. It's good that you've got fast reflexes. You caught it. Let me see if I can put that down here so that it won't fall on you. So, for example, the first thing I'm going to tell you. Like when you're running, your chest heaves a lot, and when you're kind of chilling, it doesn't. So when you breathe with your stomach, you're kind of telling your parasympathetic system, hey, pay attention to my stomach. We're chilling out. When you breathe a lot with your chest, you're kind of telling your body, you're activating that sympathetic system. You're kind of saying, like, look, we're in an emergency. Normally it's your sympathetic system that makes you do that in an emergency, right? But they're feedback loops, okay? So this is how it was explained to me by my doctor at the VA, basically, while I was getting treated. So, and I've used this before to help other people as well. So, try putting a hand on your chest and a hand on your stomach. When you breathe, see if you can make your stomach inflate like a balloon. I want you to practice this for like 5 to 10 minutes a day, which is actually an incredibly long time. 5 to 10 minutes is a lot. But I'm going to give you this handout in the description. You can get a little more information. The idea behind doing that is to essentially train yourself to maintain a certain amount of control over your breathing and kind of get to know your autonomic systems a little better. You can think of it like exercise, like the same way if you were running, you are using those leg muscles and toning them. Kind of same thing. We're going to be intentionally triggering our parasympathetic system to tone it so that it doesn't flip out, right? And same with your sympathetic system, to kind of tone it so that it is where it's supposed to be, right? So when you breathe in, there's a couple things you can do. There's 2 kinds of breathing. One that helps me most because it's emotional is ujjayi breathing. It's like part of a pranayama sequence. Ujjayi breathing, it sounds like this. Kind of like a snore. You're heating up your mouth and making a warm, like, cauldron in your mouth. And I find that to be the most relaxing. And I take really slow breaths, and I count 8 and 8. So I count in 1, 2, 3, 4. 1, 2, 3, 4. Holding it. And then out, 2, 3, 4, 5, me when I was shadowing with some integrative medicine folks in medical school. But my provider at the VA said, well, I mean, you can kind of stress your body out if you're breathing so slowly. And for some people that might be true, because you can be breathing so slowly that your body's like, where's my oxygen? Where is it? So start with what you're comfortable with, 4 seconds, 5 seconds, whatever works for you. So the ujjayi breathing, I think, is a little hard to learn. It took me a while to get the sound. It's kind of like a snore. It's kind of in your nose, out your mouth, closing your throat. Like you close the top of your throat, like. And it needs to be like, it should be hot air coming out. Okay. There's another kind of breathing. And so that's very more like Indian medicine tradition, from more like the kind of other Eastern medicine traditions, a little more like China, Taiwan, those kind of areas. You can do silk breathing. Now, it's like there's a thin silk thread going up your nose and down here, and it should make no sound. And you're breathing so slowly and controlled so that there won't be any breakage of that thread. So, that's also incredibly relaxing. So 5 to 10 minutes is a long time each day. I'm serious. You do that, you start to tone your body. Now, that's going to take a while before it's going to have effect. Just like you can't run a marathon, after just training for a couple weeks. So what can you do in the moment for your blood draw? Well, there's 2 other biohacks you can do. One, you can use the old days, like that they used to use in the old days. They used to use like smelling salts to help after people fainted. You can prevent the fainting by asking for an alcohol swab and smelling it, and it will shock your system. Cause your system to focus on something else. Why? Because your olfactory nerve is actually so close to your brain and your memory centers and all these other centers. So it's really close also to your brain stem. A lot of autonomic stuff. It's a big deal. There are other nerves that are close to your brainstem too, of course. I mean, they're all your cranial nerves are really connected down to this part of your head, up in there. But, and they don't connect really up into here. But your olfactory nerve is very special because it really has the shortest distance to go. It's like right up there in your memory centers. It's right next to them. So, you kind of shock that part of your system. You can kind of shock the whole brain. So that's one trick. Another trick to keep from fainting is you use pressures to help you. So, have you ever had to go to the doctor and they check your inguinal canal and ask you to cough? Your inguinal canal is down in your groin, if you're male, to check and see if you have a hernia. Females can also have hernias. They're not usually in the inguinal canal. Sometimes they're in the femoral ring, which is kind of where your thigh and your body, your trunk kind of meet. A little bit more in that direction. And sometimes people have ventral hernias in their stomachs. So, if you're asked to cough, right, to puff out the hernia, what you're doing is you're increasing the pressure in your body by holding it and pushing, right? It's even better if you don't cough, if you just, like bear down like you're trying to go to the bathroom, like you're trying to push something out, right? Well, when you do that, you're putting pressure on the big, giant blood vessel that's in the middle of your body, right? The big chunk. You're putting pressure on your aorta, as well as, all the return vascular that's next to it. So, like your IVC. Your vena cava. Yeah. So, your inferior vena cava, all that stuff. So, when you put pressure on all of that stuff, you are forcing your blood pressure up, right? Your vagal nerve has now tried to drop your blood pressure super low and start to pass out, but now you're pushing the blood back up. You're making sure some of it's going to stay in your head. You're pushing. You do that. You keep doing that. You take a deep breath in. And you can prevent, even when you have a super low blood pressure, I've seen that, like, I've seen crazy low blood pressures, like 80/60, stuff that's like super dangerous. And I've seen them resolve with that when people are dealing with blood draws. Another effect that you can hack is actually the placebo and nocebo effect. So if you're familiar, right, the reason in randomized controlled trials, when we're testing drugs, we have half of the people take a fake drug is because even a fake drug will have impact on people. People who think they've been given blood pressure medication will have lower blood pressure, slightly lower, because their brain will spill neurotransmitters that will cause their blood pressure to decrease a little bit. It won't do it enough to, necessarily save their life, which is why we have the blood pressure medication. But, it's interesting the power that the unity, because your brain isn't separate from the rest of your body. It's just another part of your body. People have been very dualistic, especially since the Greek era, and make us think that there's like a separate us. But your stomach even has its own complete nervous system where that can become depressed. That's what happens in IBS. It doesn't have enough neurotransmitters of the kind that cause depression in the brain, and that's why antidepressants can actually sometimes help with IBS. Not because you're depressed, because your stomach is, right? Your beliefs can be influenced by whether or not you had cheese that day. So your whole self is your whole self. Your body you're not separate from your body. You're not trapped in your body. Your body outside isn't separate from who you are. This is your body. It's all part of one big system. And when it's sick, the whole thing gets sick, right? So, a little bit of philosophy for you there. I have a lot of folks that I take care of who have so much dislike for their bodies. And it's very painful, when especially things like anorexia, stuff like that, right? It's painful because it's sad because it's often because of trauma, right? People blame their bodies for something that's happened to them. It's not your body's fault. It's the person who did its fault. Even things like dysphoria and dysmorphia, often that's not your body's fault, often that's society's fault. You are. Your body may have problems. I'm not saying it can't be sick. And it can have hormone issues. And there are even genetic problems. Like, there are folks who are XY, but they have a receptor mutation that makes their bodies not accept testosterone. So they come out looking phenotypically female, even though genetically they're male. So those kind of things exist, right? Where you actually have an issue, either genetically, hormonally, developmentally, all those kind of things. But it's still you. Your body is still you. So if there is not something wrong with your body, then there must be something wrong with the part of your body that doesn't like your body. Right? Because it's all you. So anyway, I don't know why I got off on that tangent, my dear, but I did. I've been thinking about it a lot lately because of my own experiences with things like dysphoria and the difference between dysphoria and dysmorphia, all these kind of things. So, anyway. So, the point of that is, your brain is part of your body, and it can have just amazing effects on the rest of the body. So, same thing with the pain medicine. People who are given a fake pain medicine will think they feel better. There's a flip side to this placebo effect, though. It's called the nocebo effect. It's where you tell somebody about the side effects of a medication, and then they will have those side effects. Even if you give them an imaginary medication, that's not the actual medication and can't cause those side effects. They can get nausea and vomiting in their stomach. That's a thing that can happen in response to a medicine that doesn't have that as a side effect, right? So, you can hack that. Basically, if you anticipate the blood draw more and you spend the night thinking about it, you are more likely to have a side effect or a trigger with it, a problem with it, right? So, I'm not saying that you have to, I'm not saying, oh, it's all in your head. What I'm saying is, you can hack your head to help fix the problem. So, instead of thinking about it a lot, try to do distractions, think of other things, and when you do think about it, analyze your thoughts. I actually have a cognitive distortions list I can give you as well. A little handout for you to work through, where when you have a scared or negative thought, actually, you know what's even better is catastrophizing. I have a decatastrophizing handout. The cognitive distortions is probably better. I will give you both, and you will see which one works best for you. Basically, you find your negative or anxious thought, and you analyze it using the principles of cognitive behavioral therapy to see if it's off. And that way you can actually kind of retrain your brain. We're not trying to force you to believe stuff in your head that you don't believe, right? We're not trying to have you brainwash yourself. But what we are doing is have you practice using circuits in your brain that you don't always use so that you can use them as necessary. And, essentially we're going to try to get the brain not to make the situation worse. So those are some techniques. I think we're done up here. So those are some techniques that you can use to help with your blood draws. I really, really hope they help. Down in the description, I will send you this thing. These, what did I promise to send you? Oh, breathing exercise, the cognitive restructuring, and the decatastrophizing handout. All three very, very good. These are actual things you can use for self-care, like evidence-based stuff that usually you have to pay like a ton of money to get in consultations and stuff like that. So I really, really want you to be able to take care of yourself without healthcare access is so bad right now, everywhere, all over the world. I think it's always been like that, I think. So, you do look like you might just drift off to sleep. Well, you can take a nap right here in the chair. If you want, you can use, I just washed my mask, so you can use my Manta sleep mask if you want. Kind of block out the light, take a little nap, and then